Of course, it's always very difficult to have to tell people that they've got any form of cancer, but I think particularly with brain cancer it's difficult because the expectation often these days is that there are effective treatments for a lot of cancers. But unfortunately in brain cancer that's not the case, and we actually don't have any treatment approach that can cure the majority of these patients. Surgically it's a challenge. It's not a well circumscribed tumour that can easily be completely removed. So we know that even after the best surgery, there are tumour cells left behind, and that's a challenge. It also seems that there's something intrinsic to these cancer cells that makes them able to resist our standard treatments. So they seem very good at surviving after radiotherapy and after chemotherapy. So they nearly always manage to grow back. So the approach we're taking using viruses to try and treat brain cancers is based on the idea that we should be able to use the body's immune system better to treat cancers. We deliver a virus to the tumour, and once the virus arrives in the tumour it gets taken up by the tumour cells and then promotes a local immune reaction. And so in attacking the virus, the body's immune system is also woken up to attacking the cancer cells. It was always thought that you had to directly inject agents like viruses to brain tumours because they wouldn't get there any other way. But what we've demonstrated recently, and the exciting bit of this research really, is that we've shown that if you give the viruses just by a straightforward injection into a vein, they can be delivered to the tumour that way. We've got a study that we're hoping to start very soon. As well as having standard surgery and then radiotherapy and chemotherapy, patients in the study will also, in addition, get an injection of this virus. And within that study we'll test whether those patients tolerate the combined treatment, and then whether there's any signal that they do better than patients who just get standard of care. Getting this sort of work from the laboratory into the clinic takes a huge amount of resource. We're very grateful for donations that would support the laboratory team, either with technical support or with new researchers. But equally in the clinic it needs a lot of resource to support these patients through studies, specialist nursing staff, research nurses. So these donations potentially can support the whole pathway of this research from the laboratory right through to the point where we're treating patients.